everyone, my name is Vasiliki Gkofa and today we're still on the topic of personality disorders. I decided to stay on this topic because I did notice that you were quite interested in the psychopathy video, and therefore I do want to create videos that are of high interest to you as well. So in this short clip we're going to discuss about paranoid personality disorder, the key features of someone who might be diagnosed with paranoid personality disorder, so what we call PPD, the etiology behind this disorder, attachment styles during childhood and later on in adulthood, prevalence, as well as potential treatment. So let's start. PPD, which is paranoid personality disorder, as I said, is hypothesized to lie within the schizophrenia spectrum. So there is also genetic predisposition. We are going to get more into the etiology, as I said, but I do want you to know of some specific facts. So there is some genetic predisposition, and from the behavioral models perspective, features like suspiciousness and mistrust, which are also key features of someone who is going to be diagnosed with PPD, are hypothesized to be learned from the environment. An individual who does display those features is always going to test another person. There is also going to be a constant mistrust, and of course there will be a withdrawal from the environment, so they will not open up with others. There are also persecutions. So the best way to think of the PPD individual is to think of triad of features. So we have suspiciousness, we have grandiosity, and we also have persecutions. Now, because the suspiciousness and the mistrust is chronic, what we will see is the individual, unfortunately, will not be able to create positive, strong relationships with other individuals, and there will also be a lack of personal growth. So let's move on now to etiology, because I think talking about the etiology will give us a very good grasp of why and how someone might develop PPD. So let's travel back in time to the time of Freud. I don't think there is any need for me here to tell you who Freud is, because I'm pretty sure that even if you have no interest in psychology, even if you have no knowledge in any psychological topic, I'm pretty sure that at some point in your life you did hear the name Freud. So during one of his cases, Freud supported that paranoia, so symptoms like suspiciousness and persecutions, are actually the product of repressed urges. We're not going to get more into Freud because although his ideas were brilliant, especially for his time, they're quite confusing and definitely out of the scope of this video. But I do want us to focus on other aspects, on other ideas. So during the 60s, other psychologists like Cameron supported that features that we might see in someone who develops PPD, such as lack of trust, are actually stemming from an abusive environment. Now, if you have not watched our video on child abuse and bullying, I should probably mention here that an abusive environment is an environment that there is a lack of support, lack of love, lack of comfort. So the parent will actually behave in a more cruel, more degrading manner. So they will not soothe the child. So for instance, let's say that the child might start crying. What is highly likely to be seen is that the parent will not go to the child to comfort the child, will actually behave in a more cruel way. Or for instance, they might hit the child. If the child makes a mess, or if they break something, or if they fall, they won't go to see if the child is okay. They will always behave in a more harsh way. They will instead of calming them down, they will even hit them and scold them. So it's always them to blame. Now, for instance, if the child comes home and tells the parent that this is what happened at school and the teacher put us in detention, and the child is trying to explain to the parent that it was not my fault, the parent will always assume that it's the child's fault. So what will happen is that the child will learn not to trust others, and definitely not to cry, not to seek assistance, and always expect those attacks from others. Because imagine if you have not received that love and support from your parents, even when you fall, or even when you know that you're telling the truth and you are not to blame and the parent was cruel to you. Imagine how you will think of others, what you will think, the suspiciousness that you will have of others. So other examples will include that, for instance, if there are siblings and the child, let's say they're all doing something, they're all quite creative or they're all quite smart, what will happen is that the child will often be blamed of things, will often be viewed in a more negative way, and definitely the siblings will be the ones that are preferred. So you see, the child will learn that people are not to be trusted, and that's why there will be a chronic mistrust towards others. Now, some other aspects that I want you to remember include the fact that besides the parent being cruel, controlling, and harsh towards the child, there's also this constant negative view of the child. So the child will always hear that they are arrogant or they might be stubborn. So it goes without saying that this child will learn not to trust another individual, will learn to always expect those attacks from other individuals, and that's why the fear and the distancing comes from being able to protect themselves from potential abuse. What we might also see is the fact that actually the individual might start mimicking some of the behavioral responses that they have seen from the parent. So for instance, they might identify themselves with a more cruel and more harsh way, and they might behave like that towards others, but that is only in order to protect themselves. Now, according to Beck, and if you do not know who Aaron Beck is, he's the father of cognitive behavioral therapy, CBT, a really important therapeutic approach. So do check him out. He's really important in psychology. And according to Beck, he supported that the core cognitive schemas of someone with PPD include the fact that there is feelings of inadequacy and poor social skills. And there's also an external attribution of blame in order to reduce potential feelings of anxiety. Now, when it comes to causation, so if we want to know, well, what causes it really, at the moment we have a biopsychosocial model. So we support that there is the perspective of the biological model. So as I said, there is a genetic predisposition. We also have social factors, so the way that you are going to interact with individuals in your early development. So with friends, family, any other individual to your close proximity during your childhood years. We also have psychological, so your own personality features that are, of course, shaped by your environment as well. So according to this model, we need to take into account all of those features. So let's move on now to attachment. As you might imagine from everything that we've said, the attachment that the caregiver and the individual with PPD will have is a bit distorted. So the attachment style is a fearful attachment style with a sense of unworthiness and a presumption of rejection and mistrust. Because there's this chronic presumption of rejection and mistrust, what we might also see is that the individual with PPD will also not trust their own thoughts and their own feelings, as well as the intentions of others. So they also believe that they are special and different, and they have learned to guard themselves by not believing them in order to protect themselves, as we said. Now, during childhood, when they are children, they will avoid their parents. They will not go to them to comfort them because they have associated them with something cruel, with something harsh, with something controlling. Now, there is actually no difference in their preference in a stranger and in their parents. So that tells you that they have no special feelings towards their parents, which is actually quite, we would say, surprising, since we do have this special place in our hearts for our loved ones. But for an individual who has been receiving this abusive, controlling, judgmental side, definitely there won't be this special side. Now, as adults, they will not invest, there will not be any emotional investment in social and romantic relationships, and they might not want or they might not be able to open up about their thoughts and feelings to others. When it comes to prevalence, research studies have shown that actually men are more likely to be diagnosed with PPD, but I do want you to take that information with a pinch of salt, because actually that might be attributed to the manifestation of the disorder. So by that I mean, if we take a symptom like aggressiveness, men are more likely to express their aggressiveness more openly. Whereas women, it does not mean that they're not aggressive, it just means that their aggression might be expressed in a more subtle way in society. So let's move on now to treatment. Well, what I do want you to remember is that treatment is mainly being provided on one-to-one basis, so individual therapy. This is because if it were to be provided in a group setting, so group therapy, probably and highly likely it wouldn't have worked. And this is because of the symptoms of someone with PPD. Remember, the symptoms that are mainly there include suspiciousness and mistrust. So imagine that you are sitting in front of 10 other people. What you will probably be thinking is, why are those people staring at me? Or they're being judgmental, I cannot trust them, I cannot believe them, I cannot open up to them. Therefore, therapy won't work, and actually sometimes it might make things worse. So symptoms might actually be enhanced instead of being reduced. And this is why we prefer one-to-one therapy. Now, the goals of therapy definitely include to build trust, to build positive relationships, so for the individual to trust and open up to others, and of course to reduce that cruelty, that aggressiveness side that has been learned from their parents, and therefore they mimic that behavioral response. Now, what I want you to remember as a therapist is that you are being viewed as anyone else. So you are also being viewed as an individual that they cannot trust, they cannot believe, and it's very difficult for them to open up to you. Therefore, you need to be patient, and some of the things that you could apply, let's say some tips, is to always do what you're going to say and always say what you are going to do. And by doing that, you are showing to them that actually I do come through, I can come through, and therefore you can start earning their trust. It's very difficult, and that's why I do want to stress that you need to be patient. Now, I don't want to get more into the components of therapy and how therapy can be successful with an individual with PPD, but I do want us to move on to medicine. So, according to research studies, there's not one medicine that has shown to be fully successful, so the efficacy of medication. This again might be because of the symptoms of someone with PPD. So because, as we said, there is suspiciousness and mistrust, actually 1 in 10 individuals will admit themselves into therapy. Therefore, we do not have, let's say, so much evidence as to the most successful drug. There's also the difficulty with knowing if it is a personality component or whether those are symptoms of mental health disorders like depression or anxiety. So that might also be something that makes medication and efficacy of medication more difficult. Now, of course, there are mood stabilizers, and we do prescribe those medications, so psychiatrists can prescribe the medications in order to reduce aggressiveness and impulsivity, which is something that we said that is a key feature of someone with PPD. And Prozac has also been shown to actually be quite effective with someone with PPD, and again towards their suspiciousness and definitely towards their aggressiveness. So that's it for today, guys. Thank you very much for watching. Today we discussed about another personality disorder, paranoid personality disorder, and we started off by discussing some key features, the etiology behind this disorder, the prevalence, treatment, as well as attachment styles during childhood and adulthood. Now, as always, I want to give you a book recommendation, and I have it right here. So this is called The Clinician's Guide, Diagnosis and Treatment of Personality Disorders by Daniel Fox. So if you are interested in personality disorders, this book is amazing. It definitely has everything in here and many of the things that we discussed in this video today. So I would definitely recommend you checking this out if you are interested. Thank you very much, guys. Bye.